Hi guys, today I'm gonna talk about the scapulohumeral rhythm. You know, this is the scapula and this bone is the humerus, and they articulate and make the glenohumeral joint or shoulder joint. So as you see here, we have the head of the humerus, and this is the glenoid cavity of scapula. They articulate to each other and make a glenohumeral joint or shoulder joint. So what is the scapulohumeral rhythm? So if you look at here, my upper limb is moving away from the midline. This is the midline, moving away from the midline. It's called abduction. If you put your hand on your scapula, inferior angle of the scapula, so this is the inferior angle of the scapula. If you put your hand on the inferior angle of the scapula and moving away from the midline, and during the abduction you feel that the inferior angle of the scapula and the whole scapula moving away from the midline as well, which is known as the lateral rotation of the scapula. So imagine that this is the humerus, this is the scapula. During the abduction, the humerus is moving away from the midline, but the scapula also, inferior angle of the scapula also moving away, and makes the lateral rotation of the scapula or outward rotation. So they are not independently moving. We have a couple motion, both scapula and humerus moving together. So during the abduction of the humerus, scapula also rotating laterally. So it's called the scapulohumeral rhythm. So why we have scapulohumeral rhythm? There is a big reason behind this. So if you look at here, this is the greater tubercle of this humerus. So when you are doing abduction, what will happen? The greater tubercle hitting the acromion process of the scapula, and it causes the impingement. We don't like it. We want to do impingement. For preventing the impingement, so we have the abduction of the humerus and we have the lateral rotation of the scapula. So lateral rotation of the scapula make a clear way for the greater wing of this, so for the greater tubercle of the humerus. That's why we have the lateral rotation of the scapula, to prevent it from impingement. So which muscles are working together to do abduction of the humerus and lateral rotation of the scapula? So if you look at here, we have a muscle here, a large chunky muscle we have. It's called the deltoid. If you look at this plastic model, this is the arm, here is the forearm, and you can see from the posterior view, this is the scapula, spinal scapula. From the anterior view, you can see the clavicle. This muscle is known as the deltoid. Please watch my previous video about the origin and insertion of the deltoid. You can see that the deltoid covering the shoulder joint laterally. That's why when it contracts, can do abduction of the humerus. So during the abduction of the humerus, as I mentioned before, the scapula rotates laterally. So this is the scapula. Scapula rotates laterally. So which muscles rotating scapula laterally? We have trapezius muscle. You know, imagine that my hand is the midline. So trapezius coming from the skull and the spine, vertebral column, and attaching to the spine of scapula. So here, upper trapezius and lower trapezius. So upper trapezius and lower trapezius, when they contract, they can do lateral rotation of the scapula. Inferior angle rotates laterally. We also have another wide muscle. It's coming from the anterior. It's coming from the rib 1 to rib 8, and then wrapping around the ribs and attaching to the medial border of the scapula and inferior angle of the scapula. The muscle fibers of the serratus anterior that is attaching to the inferior angle, when they contract, it can also do lateral rotation. So upper trap, lower trap, and serratus anterior, these three muscles work together and do lateral rotation of the scapula during the abduction of the humerus. So deltoid can do abduction, upper trap, lower trap, and serratus anterior. These three muscles do lateral rotation of the scapula. So if you look at carefully here, as you see, the head of the humerus is 3 times larger than this shallow glenoid cavity. So it makes the shoulder joint very unstable joint, and it allows the shoulder joint to move around. But it's not unstable because of this biomechanics of the head of the humerus and shallow glenoid cavity. So when you are doing abduction, the head of the humerus tends to glide upwards. We don't like it. We want to prevent it from upward gliding during the abduction. So we have some small local dip muscles around the shoulder joint. When they contract, they stabilize the shoulder joint and prevent it from upward rotation. They are known as the rotator cuff muscles. So we have 4 rotator cuff muscles. The abbreviation is SITS, S-I-T-S. The first S stands for supraspinatus. It's coming from here, supraspinatus fossa. This is the spine. Above the spine, we have supraspinatus. Infraspinatus coming from here. And then teres minor from this area, lateral border. Supraspinatus, infraspinatus, teres minor, 3 posterior rotator cuff muscles. And anteriorly, we have subscapularis. So all these muscles crossing the shoulder joint and attaching to these tubercles. So SIT, supraspinatus, infraspinatus, teres minor, they attach to the greater tubercle, whereas the subscapularis, the last S, attaches to the lesser tubercle. So they act like a cuff. They are covering the glenohumeral or shoulder joint like a cuff. And when they contract during the abduction, they are pulling the humerus down and prevent it from upward gliding. So rotator cuff muscles stabilize the shoulder joints. I can show you the rotator cuff muscles here. Again, here is a posterior view of the scapula. From the posterior view, this is the spine of scapula. I'm going to take the deltoid off. So this is the spine of the scapula. Above the spine, we have supraspinatus. Below the spine, we have here we have the infraspinatus, the chunky muscle, and this muscle is the teres minor. So the 3 posterior rotator cuff muscles, they attach to the greater tubercle of the humerus, and anteriorly we have this strong subscapularis muscle that attaches to the lesser tubercle. So as you see here, all these 4 muscles, they are covering the shoulder joint from different view, posterior, superior, anterior view, and they stabilize the shoulder joint during the abduction. Yeah, this is the muscles that are working together. The other key point that I'm gonna mention is that also the trapezius muscle stabilize the scapula. What does it mean? So you look at here, scapula also just articulates with the head of the humerus, and it articulates with the clavicle here. It does not articulate with the ribs. It's a wobbly bone. It's wobbly. During the lateral or medial rotation, it's wobbling. We don't like it. We want to provide a firm base for the deltoid and rotator cuff muscles. For this job, we need some muscles to stabilize the scapula, prevent it from being wobbly. So as I mentioned before, the upper trap, lower trap, and rotator cuff muscles, when they are contracting, they are laterally rotating the scapula. The inferior angle rotates laterally. They also simultaneously stabilize the scapula, prevent it from wobbling. How? You know, the upper trap, other action is the elevation, lower trap, depression. So they are synergistically canceling out unwanted elevation and depression movements and keep it the scapula, prevent it from upward and downward wobbling. We also have the serratus anterior that's attaching to the medial border, and The other action of the serratus anterior is protraction. This is the protraction. Moving the upper limb forward is protraction. So in addition to the lateral rotation, serratus anterior do protraction. So we have some muscles like middle trap attached, they attach here. So middle trap and rhomboid major, these two muscles, they are retracted. So they are cancelling out unwanted protraction and fixing the scapula, prevent it from going forward and backward, upper trap and lower trap. So all these muscles working together and prevent the scapula from being wobbly and provide a firm base for the deltoid and rotator cuff muscles to do their jobs efficiently. So I'm gonna focus on some words. You know, we have some words like synergist, agonist, movers, stabilizers, so because students get confused. So when a muscle moving and acting, it's called the mover. So the deltoid is a mover or agonist. When it's contracting, during the contraction, it can do abduction. So the deltoid is a mover. Or upper trap, lower trap, and serratus anterior, when they contract, they can do lateral rotation. So they are mover or agonists. Whereas the antagonist means the muscles that are getting relaxed and they allow the agonists or movers to do their job efficiently. For example, I'm going to give you an example here. We have the biceps brachia. It's contracting and doing flexion of the elbow. Opposite to the biceps, we have triceps at the back of the humerus. They are getting relaxed during the flexion of the elbow. So antagonist muscles are triceps. They are getting relaxed. What about the stabilizers? As I mentioned before, we have rotator cuff muscles. They are stabilizing. What does it mean? It's prevent the head of the humerus from gliding upwards and keep it at the center of the glenoid cavity. It's called stabilizing the shoulder joint or glenohumeral joint. Or we have upper trap, lower trap, and serratus anterior. In addition to being mover, they are also stabilizers, stabilizing or keeping the scapula fixed, prevent it from being wobbly. So these are the words that students get confused. If you have any questions, please ask me and receive the responses. Thank you so much for your attention.